If you are, I don't know, let's say 65 or over, and you're going to have a brain MRI, you'll have white matter disease on it. It's ubiquitous, and it'll say chronic microangiopathic disease or chronic ischemic microvascular disease, or it'll say white matter disease on the report. Everybody has those, and they'll gauge it as mild, moderate, or severe. The amount of white matter disease actually can be quantified. We have protocols for volumetric analysis and adding it all up three-dimensionally and giving you the total volume, but that's generally not done in clinical practice. And what it is dead brain tissue. White matter disease is dead brain tissue, and it's dead brain tissue that died because of lack of blood flow. And it isn't a stroke. A stroke is dead brain tissue from lack of blood flow, and white matter disease is dead brain tissue from lack of blood flow, but they have a different lack of blood flow mechanism. So in a stroke, ischemic stroke, which is the majority of it, there's a sudden occlusion of a blood vessel. A fairly large blood vessel suddenly gets blocked, no blood flow goes through. The tissue that requires that blood dies. That's a stroke. It's a sudden onset of usually clinical event, although there are silent strokes. White matter disease is chronic lack of blood flow because of poor flow state. So what's happening is in small blood vessels, maybe borderline microscopic blood vessels, there is stenosis, there's narrowing of that tiny artery because of deposition of plaque, and that artery becomes less pulsatile, meaning it's not pumping because a lot of the pumping is done by blood vessels, and it also has increased resistance, right? So the resistance to flow is inversely proportional to the radius. So the smaller the pipe, the higher the resistance. And so what's happening is there's a decreased flow rate, and the flow rate is so low that the tissue that needs that blood is having chronic ischemia. Ischemia is lack of blood flow, and it ends up dying, and so we see it. White matter disease is ubiquitous in the U.S. It's associated with this small vessel atherosclerotic disease, and the main risk factors are smoking, diabetes, hypertension. It is associated with cognitive decline. Right now, we don't have proven therapy for it, so that's annoying. Eat right and exercise. Keep your blood pressure low. Make sure that you're being healthy so you don't get white matter disease because everybody's getting it.